Everyone, welcome to my live stream event. Hello everyone, welcome to my live stream event. Hello, welcome to my live stream event. My name is Morolake. I'm a registered nurse presently practicing in Nigeria. If you have been my channel for the first time, I welcome you to my channel. My channel is all about enlightening individual, family about some health challenges that can be prevented if the individual has the knowledge to do so. Most especially, I use my channel to talk about women's health. And today, I've sent out a poster already that I want to talk about understanding your hepatitis test results. What I want to talk about in this live event is understanding your hepatitis B test results. So before going to interpretation of test results, hepatitis is a global health challenge. It's not peculiar to one set of country or one set of people. It's not peculiar to one set of ethnic group. It concerns everybody. It's health, a global health issue. And before going to interpretation of results, if you are coming to my channel for the first time, I welcome you. Thank you for watching my video. So let's talk about what is hepatitis before going on to discuss or interpretation of the test results. Hepatitis is an inflammatory disease of the liver which can be caused by viral infection through blood-borne disease. It can be through fecal oral, what is being taken in, what an individual eats, what is being taken in through poor hygienic condition or poor environmental condition. Hepatitis has family label. It has different type, ranges from hepatitis A, B, C, D, and E. It has 5 types. And the A and E are fecal oral. Hepatitis A and E is caused by what is taking it, what an individual eats through poor hygienic condition or through poor environmental condition, whereby the hepatitis B, C, D are blood-borne infection, which is caused by viral infection. It's caused by parenteral infection, blood-borne disease like needle prick. Through needle prick, an individual can be infected with hepatitis B, C, and D through needle prick, through needle stick, and this is most common hazard to health worker. Through needle prick, through needle stick, through using of same needle prick in drug user, and it can also occur through transmission of hepatitis from an infected mother to their newborn. This is a blood-borne infection. So now moving forward to interpretation of hepatitis test results. I'm going to talk about interpretation of hepatitis B test results. Before these tests can be interpreted, an individual has to do 3 tests, not like the single one that everybody is familiar with. That is hepatitis B surface antigen. Most of the time, this is what people are familiar with. But to interpret the test, an individual has to have 3 tests being done. Hepatitis B antigen, surface antigen test, hepatitis B antibody test, and hepatitis B core antibody test. An individual must do these three tests to interpret the hepatitis test results. It's not a single one. So hepatitis B surface antigen test, hepatitis B antibody test, and hepatitis B core antibody test. So all these three tests must be done before the interpretation or the status of an individual can be known. So if an individual now go for a test and receive a test result as the following, I'm going to call it out and I'm going to interpret what the test actually mean. So if an individual went to do hepatitis B investigation screening and the surface antigen test shows that the individual has positive result of surface antigen tests for hepatitis B. That means the individual is being infected. The surface antigen is present and the individual is infectious. The individual can actually infect another person at that stage, and the antibody is negative. This person that has reactive, positive surface antigen test, antigen result for hepatitis B now has negative hepatitis B antibody test. And the individual, what this means is that, and the core, at the core is positive. Hepatitis B core antibody is positive. This indicated that the person is acutely infected, that the person is infectious, and the person can actually transmit the infection to another person at that particular time. I've interpreted the three surface antigen present, positive, reactive for this person, but the antibody is negative, and core hepatitis B core antibody is also positive. This person is hepatitis B positive and it can infect another person. And the hepatitis B core antibodies does not end there. It is positive. But they have to know, is it that the individual is presently infected or the individual has been infected previously? So they can now go, since the individual, it shows that the individual is positive, hepatitis B positive, there is need to investigate the hepatitis B core antibody that is positive, that is reactive. And further investigation can be done like anti-hepatitis B core antibody. If it's IgM, I will be using that in immunoglobulin M. If it's IgM positive, that indicates, and the IgG is negative. The IgN indicates that it's the person is having a current infection, and the individual with that result can infect another person. So let's now go to another test result. I'm going to cite an example. If another person now go for their own hepatitis B screening test, when the surface antigen is positive, hepatitis B surface antigen is positive and antibody is now negative, whereby the hepatitis B core antibody is negative. This means that the person is infected with hepatitis B and it's recent. The body has not actually been able to produce an antibody or core antibody for the infection. So there is need for further investigation, like knowing the liver functioning test, like going for the DNA, and also look for a knowledgeable doctor to interpret the results for you in order to know the line of management to follow. But this person is infected at this period of time. If another person result now say surface, if another person now go for the test and hepatitis B surface antigen is negative, whereby the antibody hepatitis B titer test is positive, and the person also have hepatitis B core antibody which is positive, but they have to investigate the hepatitis B core antibody if the person is just newly infected or the infection is newly in the blood of that individual or it has occurred from the previous infection. So that is when you are going to go for IgM test and IgG test. The IgM is for recent infection, while the IgG is for infection that has occurred previously. The individual is newly infected. But now let's go to another, the fourth test, interpretation. The fourth test, interpretation. In this fourth test, hepatitis B surface antigen is negative. When the individual go for antibody titer, it also is positive. This individual go for surface antigen test, hepatitis B surface antigen test, it says negative. And when the individual now go for hepatitis B antibody test but says positive, individual now go for the third test before it can be interpreted. And the third test is hepatitis B core antibody test and it shows negative. This shows that this individual has not been infected. This individual has been immunized and sensitized against hepatitis B infection. This individual is already have an antibody which is provided by vaccine. This individual is already covered and have immunity against hepatitis B infection. So if another person now go for our own test, and when the person is tested for hepatitis B surface antigen is negative, unreactive, the virus is not detected in this person blood as at the time of testing, and this person also do hepatitis B antibody test, it shows negative, and the person now do the third test, hepatitis B core antibody, and it also shows negative. This person is negative all through. The surface antigen test is negative. Hepatitis B antibody test is negative. Hepatitis B core antibody test is also negative. This shows that the individual has not been infected, but the individual does not have immunity against hepatitis B infection. The advice for this individual is to be vaccinated against hepatitis B. For an individual, this shows that the individual has not been infected at test, and the individual does not also have immunity against hepatitis B infection. There is need for this individual to go. The advice for this individual is the individual can be vaccinated against hepatitis B infection. When another person now go for their test, and the test shows the surface hepatitis B surface antigen is positive, and the hepatitis B antibody test is negative, and the hepatitis B core antibody is now positive. There is need to know if this individual hepatitis B core positive test is as a result of a new infection or if the individual has been infected previously. That is when there will be need to go for IgM and IgG tests. But when the IgG now shows positive, but the IgM is negative, this shows that the person is infected, that this person, individual, is infected. There may be need for further investigation to choose the line of management, and there may be need for other tests like liver functioning tests. The hepatitis B DNA test can also be done in order to know the line of management and what to do for this individual. So let me go over the interpretation of the test again and the reason why I'm doing this video. Number one, if you go for a test as an individual and you go for a test, a screening for hepatitis B, the most common one is to check the surface antigen. Hepatitis B test is for surface antigen, but it has to come in combination of three tests to denote if the individual is being infected or not, if it presents infection or if the individual has been infected previously, to know if the individual is infectious, that the individual can actually infect another person or not. So I'm going over it again. If an individual go for a hepatitis B test and the surface antigen body test is done and the individual is positive, when a surface antigen, an individual is being screened for hepatitis B and the surface antigen says positive, that means reactive, and test for antibody and the antibody is negative, and the individual now go for the third one before the test can be interpreted for hepatitis B core antibody, and it shows that the person is positive. This shows that the person is positive, but we have to further know, is this person presently acutely infected, or is it acute infection or a chronic infection that has been going on for a very long time? That is when they will go for IgM and IgG. Hepatitis B core antibody. IgM indicates a new infection, ongoing infection. Apart from that, for a person to now have a chronic hepatitis and has a positive IgM, it can be a exacerbation of hepatitis or because of a liver infection. But for the IgM indicates that this is an ongoing infection. This shows that the person is acutely infected with hepatitis B and the person can infect another person. Now for the second interpretation, if an individual go for hepatitis B screening and the screening shows that surface antigen, hepatitis surface antigen is positive, reactive, and when the person now goes to check for hepatitis B antibody and the result shows negative, but the person have surface antigen positive, and the person now go for to check for the third test before there can be interpretation for that person, and the person now go to check hepatitis B core antibody, both shows negative. This indicate that this is a recent infection. The person is infected with hepatitis B because of the surface antigen present, but the blood has not been able to form an antibody. That is why the antibody is not shown, and the body has not been able to even produce hepatitis B core antibody as well. The person is recently infected, and there is need for further investigation like hepatitis B, DNA check, liver functioning test, and to know the further investigation and how to manage this condition, you need to see your healthcare provider. The third test now shows when another individual now go for their own screening test for the hepatitis, but the surface antigen is not present. Is the person's not blood non-reactive at the blood unreactive. That means the surface antigen is negative, but the antibody is present. Hepatitis B antibody is present, and also hepatitis B core antibody is positive. So there is going to be need to know that hepatitis B core antibody, is it for new infection or for previous one that still remains in the blood of that individual, and it shows that that individual has positive IgM. That means the person is being infected and is a recent infection. If the fourth individual now go for their own hepatitis B screening tests, the third individual go for their screening test. When the individual tests for surface antigen, hepatitis B surface antigen is negative. Hepatitis B antibody check is also negative. Sorry on that. Well, let me come again. When an individual now go for their test, check for hepatitis B surface antigen, said negative. Hepatitis B core antibody also says negative, and the person now go for hepatitis B antibody test and said positive. The IgM said negative, the IgG says negative. This indicates that the individual has not been infected, but the individual already has an immunity antibody through vaccination. This individual has never been infected. For individual with negative antigen, surface antigen, for individual with positive antibody but negative hepatitis B core antibodies. This shows the individual has not been infected, but the individual has antibody, produce an antibody immunity against hepatitis B through vaccination. The last test I'm now going to talk about, another person now go for their own screening. And the screening shows that the person, when the individual is being screened for surface antibody, for surface antigen, hepatitis B surface antigen, and it says positive, the individual go for antibody, hepatitis B antibodies, and shows negative. And the individual now go for hepatitis B core antibody, and it also shows negative for IgM and so positive for IgG. That means the individual has a chronic infection. The individual has been infected, and the IgG will be present in the individual blood. That is marker that the individual has been infected with hepatitis B viral infection. If another individual now go for their own screening, if they are being checked for hepatitis B surface antigen, non-reactive, negative, go for hepatitis B antibody check, also says negative. Go for hepatitis B core antibody, also says negative. That three tests says negative. And when they now further check for the hepatitis B core antibodies, they check for the IgG and the IgM, all those two also says negative. That means the individual has never been infected, has never been exposed to hepatitis B, but this individual needs to be vaccinated as a medium for prevention against hepatitis B infection. So I think I've repeat this interpretation of test three two times already. So now going to prevention. I've discussed about different type of hepatitis that it has a family label of 5 from hepatitis A, B, C, D to E. I mentioned that two of it are fecal oral, as is transmitted through what we take in through poor hygiene and poor environmental condition, whereby the other three, hepatitis B, C, and D, are blood-borne infection. Through needle prick, the individual can be contact this infection through needle stick, through needle prick, and through contaminated blood. The individual can be infected through sexual intimacy. It can be through oral, vagina, and anal sexual intercourse. And it can also, the individual can transmit, there can be vertical infection transmission. A infected mother can actually transmit the infection to their newborn as well. So how can we now prevent it? We can prevent it through proper hygienic condition, through proper environmental condition for those one that can be caused by fecal oral. Proper hygiene, proper environmental condition can prevent hepatitis A and E. And if an individual is traveling to an area that there is predominant hepatitis A and E in that environment, there is need for the individual to be infected, to have vaccine against hepatitis A and E. This is very important. For the blood-borne infected hepatitis B, C, and D, how can we now prevent those blood-borne hepatitis infection? Through monogamous sexual intercourse. Be faithful to your partner and ensure that even your partner has a monogamous sexual intimacy with you alone. Avoid multiple sexual partner. Avoid sharing of used needle among each other. And for mother, to prevent hepatitis transmission from mother to their newborn, to prevent hepatitis B infection from the mother to the newborn. The Hepatitis B Foundation and WHO has a protocol and a line of management for that. The first thing is to screen pregnant women, and that is normal routine practice in every well-established clinic or hospital. For a new registrar, for a new registrant in an hospital, they have to screen the individual for hepatitis and some other routine screening for antenatal registration. If they now denote that an individual is positive during pregnancy, they're going to screen for some individual and place them on antiviral drugs. It's not every pregnant woman, but there are selected ones that can be on antiviral drugs during pregnancy, which depend on their screening test. And there is a protocol to follow in preventing hepatitis B viral infection from infected mother to their newborn. Is that the baby that is born to an hepatitis B positive mother must have immunoglobulin injection immediately after exposure. That a newborn must have immunoglobulin injection, which is short positive vaccine, because these newborn did not have immunity to fight against hepatitis infection. So immunoglobulin is being given to them. It's passive immunity against hepatitis B infection. So it's important, it's laid down protocol in preventing transmission of hepatitis B to newborn. This is a very important. So the baby will have the immunoglobulin vaccine, and that does not end there. Like I mentioned, that this is a passive shot prevention after exposure during the delivery of the baby. Most of the time, the mother blood and the baby blood do not mix in pregnancy. It's only if there is trauma or there is some procedure that can cause the blood of the mother and the baby to mix during pregnancy. But if this does not occur, the only time that is likely for the baby blood and the mother blood to mix together is during the birth of the baby. And this is when the baby born to hepatitis B positive mother can be exposed to the viral infection. And the baby must be given immunoglobulin, a passive short-acting prevention against hepatitis B infection. But that does not end there. It does not mean because the baby has have immunoglobulin that the baby should not have the routine hepatitis vaccine against hepatitis B infection, the normal routine for children during their childhood. The baby still have to have that one. I've mentioned that immunoglobulin is short passive acting vaccine because the baby has not developed enough immunity, and the normal routine one is not yet, cannot convert immunity to the baby at first dose. There is need for individual to have 3 doses of vaccine because at first dose, the normal routine vaccine against hepatitis B, the baby will not have immunity to fight against that infection. That is why they are going to give them their 3 doses according to the immunization schedule program and according to the appointment given to the baby's mother. So it's essential that the baby have the short-acting vaccine and the long-acting vaccine, the normal routine one, to convert immunity against hepatitis B infection. So in prevention of adults, and as an adult need also to be vaccinated, like I've interpreted in the test results. For an adult, after their tests, before giving the vaccine, they must be tested. So it's not like I want to have hepatitis B, I want to have vaccine against hepatitis B. I can just walk to the immunization center and have my vaccine. It's not, it doesn't work like that. You have to be screened against as the individual has infection before. Is the individual newly infected, or is if the individual has not been infected at all? That is when they can now give an adult the vaccine. So, and there are people that are allowed to have the vaccine according to their screening. Like I said, if they test and there is no, and their results shows that the surface antigen is negative, not reactive as at the time of doing the test, check for the antibody. Hepatitis B antibody also shows negative. Hepatitis B core antibody also shows negative. The IgG or IgM, that is when they can now go, they can now have their vaccination to have an immunity against hepatitis B infection. So now going to have discuss about what hepatitis B is all about. I've discussed about interpretation of test results. I've discussed about the prevention. Now going to the signs and symptoms if these occur. Initially, it can be a mild signs and symptoms like loss of appetite, lethargy, fatigue. The individual feel weak, unable to eat. It can graduate to rashes, itching, but in a more severe case, there can be yellowish of the infected individual skin and the clearer of the eyes that individual can see, and every other people around the individual can actually see that something is ongoing in the individual system. So I've come to the end of this video. Thank you for watching my video. Before I go, I'm going to actually need to post the poster up. Let me say, I'm going to post the interpretation of the results so that we can go over it and be able to pick one or two things to actually understand the test interpretation. Thank you for coming to my live event. Until next time, I'm doing another video. Bye for now and take charge of your health. Bye bye.